Hi, I'm Dr. Lonny Green at Revie Aesthetics in Richmond, Virginia. You've got questions about Botox? I've got answers. What is Botox? Botox is a purified protein that works to relax muscles. That's simple. What are common areas of treatment for Botox? The most common areas are forehead for the lines that form across here, between the eyebrows, what we call 11s or frown lines, and on the sides of the eyes, what we call crow's feet. Where else on the face do we use Botox? Well, multiple places. We can use Botox at the tail of the brow to give it a little bit of lift. We can use Botox for the lines across here called the bunny lines. We can use Botox here to flip the lip up and give a little more show of the lip. Or if when you smile you show a lot of gums, we can use Botox to lower that. There's a muscle here called the masseter. Some people clench during the day or grind at night. We can use Botox here to decrease that, and it also can give an aesthetic appearance of slimming your face. We can use Botox down in the lower face. As we mature, our mouth tends to turn downward. Botox can fix that or slow that down, and we get a crease in our chin and our chin looks dimply, and Botox can help decrease that as well. What other medical uses are there for Botox? Botox has a myriad of medical uses. It's used for bladders that are too overactive. It's used for spastic muscles after a stroke. It's used for digestive problems. It has so many uses medically, and it's been used medically for decades. Is Botox safe? Yes, Botox is extremely safe. It's been used for decades. It has an unbelievably safe track record. What are the possible side effects of Botox? In general, I tell my patients that bruising is always possible. It's not common, but it's possible. Another side effect can be that the Botox can affect a muscle that we don't want it to. So sometimes your smile could get a little crooked, the brow could feel too heavy, the eyelid could droop. These are rare occurrences. They are never permanent and typically gone within 3 to 4 months. Am I too young for Botox? You know, in general, a lot of people start Botox in their late 20s, early 30s, but I don't advise Botox based on age. I advise it based on what your skin is doing. So if you, for instance, raise your eyebrows and there are a lot of lines, but then when you bring your eyebrows down, they're completely gone, I don't think Botox is necessary at that time. If, however, when you put your eyebrows down, you still see those lines and you don't love them, then I think it's time for Botox, and that applies to any areas of the face. How is Botox done? You know, we use a syringe with a very, very tiny needle. So it goes under the skin and it's injected and it's over in a second. Does Botox hurt? You know, it's a little bit of a sting, lasts for just a second and then it's gone. How long does it take to get Botox? You know, it takes some time to get to know a patient or catch up with them. The actual performance of doing it takes just a minute or two. It doesn't take long. How long does Botox last? In general, Botox lasts about 3 to 4 months. It is going to depend on the dosage and how strong your muscles are, but that's a general ballpark figure. How much does Botox cost? You know, that's going to be highly variable. Botox comes in units, and each person needs a different amount of units based on their goals and their muscle strength. I would say, ballpark figure, average patient might spend between $250 to maybe $900 on Botox. A lot of it's going to depend on goals, age, and muscle strength. What are the different kinds of Botox? Botox is a brand name, sort of like Kleenex means tissues, but there are other brands. So there's other brands called Dysport, Jeuveau, Xeomin, Daxxify, and so the brands are, each one is slightly different, but they are all called neurotoxins, and no matter what, all of them work by relaxing the muscles.